Namaste, I am Dr. Rashmi K. I am a senior homeopathic consultant at Raghav's Homeopathy Multi-Speciality Clinic. I am having around 18 years of homeopathic medical practice experience. I have worked amongst various corporate homeopathic clinics all over India. We are having around 3 branches. One is at Bannerghatta Road and the second one is at BTM Layout and the third branch is at Marathahalli. Piles is one of the most common symptom where many number of patients are suffering. It is a silent suffering where the patients are very anxious and they are very shy to go and tell about it to the doctors. So piles and fissures and fistula, these are the common problem which is related to our anal orifice or the external anal region. Whereas piles and hemorrhoids, these are same. The internal blood vessels whichever is there because of chronic constipation or because of the excessive stress what we put into the anal region, the vessels which are present inside the anal orifice will be popped out. There are 2 types of piles. One is internal piles where the mass or the swelling or the varicosity of the vessels are inside the anal orifice, where there is an external piles where the swelling of the vessel is outside the anal orifice, and also there is bleeding piles and non-bleeding piles. In bleeding piles, whenever you pass motion or before passing motion or during passing motion or after passing motion, we will pass blood with the stools. Whereas non-bleeding piles, there will be no blood passage, but you can see the mass outside or inside the anal orifice. This is called as piles. One of the major reason for the piles is chronic constipation, irregular in the diet habits, obesity, chronic sitting. So internal piles and external piles, bleeding piles and non-bleeding piles. So these are the different types of piles. In piles, we have stages also. The most important thing is stage 1 is always the neglected stage in case of piles, where the patient has constipation. So whenever he passes motion, he will have a pain over there or he will have a bleeding over there, and there is a mild swelling outside the anal orifice, but it subsides on its own within 5 to 10 minutes. This is called as first degree piles. Whereas in second degree piles, the swelling will be outside the anal orifice after 20 minutes or 30 minutes, or whenever you push manually it goes inside. This is called as second stage of piles. In third stage of piles, whatever the swelling which has come outside the anal orifice, even though if you put inside, it cannot be going inside, it will always be outside. So this is called as third degree piles. In third degree piles, most of the patients will go for surgery, but through homeopathy treatment, there is no need to go for any surgery. Only through constitutional homeopathy medicines at Raghav's Homeopathic Clinic, we will give you constitutional medicines where what are all the symptoms or what are all the piles which has come outside, it will slowly and gradually subside on its own. Fissure. Fissure is the crack in and around the anal orifice. It is a deep cut which happens because of constipation or because of the chronic pressure what we put over there. So fissure can be associated with the piles, or the simple fissures are also possible. Fistula is an abscess which is present surrounding the anal orifice where it has burrows. There is a homeopathy treatment for all the 3 issues where without any surgical procedure it can be completely curable.